So I love treating feeding disorders. I've been doing it since I started in the field of ABA. It's not my main area of interest or expertise, but it's definitely something I've been doing a lot. Anyone who works with folks on the spectrum for a while is going to meet a kid with picky eating at some point. And also, just as I was saying in the last talk, anyone who's met someone not on the spectrum is going to meet someone who's a picky eater at some point. Raise your hand, just come on, be honest, if you're a really picky eater. You're kind of a pain. Yeah, right? My wife's kind of a pain. Like, it's hard for me to cook dinner because there's so many things she doesn't like. Yeah. And she admits it. She'd be fine. I'm not being taken, am I? No. No, but so it's, it's real common, right? But it is especially common for folks on the spectrum, and I think it is probably related to sensory issues, related to rigidity, like we were talking about before, flexibility. But it can have a real impact. But here's the cool thing. Everything that I'm going to talk about today for the next hour is equally applicable to people on the spectrum as to people off the spectrum. No difference. Exactly the same procedures work. Here's another thing that I'm going to say. Well, wait a minute. First of all, can I see a show of hands that are parents of a kid on the spectrum, if you're willing to share? Okay, this talk is for you guys. Okay, that's why I'm here. So everyone else, don't try to bust me on using non-technical language or something like that. I'm going to talk common sense, real life, in the trenches, practical tips on how to fix your kid's picky eating. I'm not going to be talking a bunch of ABA mumbo jumbo, although if you're well trained, you'll be able to read between the lines and do all the translation in your head if you're as much of a nerd as I am. Okay, here's the thing. Here's kind of a big claim, and I hope I'm right. I don't know that I'm right about this, but I think that what I'm going to tell you in the next hour. Wait, one more disclaimer. I'm not talking about kids that have like medically based severe feeding disorders. So kids that are totally G-tube dependent, kids who have structural abnormalities in the development of their esophagus or their palate. What I'm saying today is not for those kids. What I'm talking about today is for kids who have food selectivity, all the way up to really severe food selectivity. So the procedures I'm going to talk about today, I've used successfully with kids that they'll only eat 2 or 3 foods, period. But here's the big news. And again, I'm not sure I'm right about this, but I might be. These procedures have worked every single time I've used them for the last 17 years. I haven't failed once. Not once. Okay? So, I'm not saying it works every time, but it has worked every time. And I'm not saying it will work every time with every one of you, but it has worked every time for me. So I don't know. That's interesting. To me, that says these are pretty powerful procedures. And I'll give you the punchline. None of it's brilliant rocket science. It's all ABA common sense. Okay. But it works really, really, really well. I haven't worked with a single kid whose severe food selectivity I could not make significant progress on. It's not going to be easy, it's going to be difficult, but pretty much everything you do in life that's really cool, almost everything, right, that you're really proud of, it's pretty difficult. Okay, let's do it. I'm not going to talk about myself. I'm assuming we still have do we have any SLPs? Do we have any OTs that work on feeding? Okay, pipe in, I'd love to hear your input. And I don't think anything that I'm going to say goes against what you do, but if it does, I'd like to know. I'd be interested to hear your perspective too. Okay, so I'm going to talk about where to start. We're going to talk very briefly about why does picky eating happen. But the meat of the talk today, the point of the talk is what can you do about it, and some tips for how to actually do it. And again, I'm talking to parents. Everything that I'm saying for professionals, you can do it too. There's no reason a parent has to do this, but the purpose of this talk is to give hope and to give real, practical, useful strategies to parents. All right, so let's talk about sort of the first phase. Before you do anything with feeding, I highly, highly, highly recommend you find out from the kid's doctor, medical doctor, that it's safe to work on feeding, okay? You don't want to start a feeding program with a kid for whom they're not physically ready. It's not safe for them to chew and swallow, okay? If that's the case, you might hurt the kid, right? Don't do that, okay? So be sure, have a medical doctor evaluate the kid, and the medical doctor should say, yeah, there's no medical reason why the kid's not eating. It's picky eating. It's not a medical problem. So get that clearance first. There's a variety of assessments that GI docs do to help establish that. I'm not going to go over all of those. I don't even understand what they all are necessarily, but I send my kid out to the medical doctor. You sign off, say yeah, it's safe. Okay. Okay, first thing you do is define the goals of your intervention. Why would we want to work on picky eating? Like let's say a kid with autism eats maybe 5 or 10 foods at the most, and they're almost all carbs. Who cares? Why do we want to work on it? Anybody?
Health.
Health. It's not healthy to eat only carbs, and it's not healthy to eat only 5 or 10 foods, right? It doesn't have the nutritional content that you need for brain development, for a number of health outcomes, right? Obesity is one of the major contributing factors to almost all causes of death, right? Like just that's majorly contributed by nutrition. So it's really, really important. And then there's social reasons too, right? Like let's say your kiddo gets invited to a birthday party. Awesome, right? That's a really good social outcome in itself. Now he goes to the birthday party and all the other kids are eating X, Y, and Z, and your kid won't do it. That makes them stick out like a sore thumb, right? That's a loss of a social opportunity. It might be an occasion upon which other kids are going to tease them, exclude them, make fun of them, so on and so forth. So there's social, medical, nutritional, all kinds of reasons. How about this too? Like, isn't eating a really big source of enjoyment in your life? Isn't it awesome that you can eat so many different things and they taste incredible? Isn't it so cool that you go to a restaurant and just order all these different things, right? There's, all the variety of food is maybe one of the coolest things that we're just given genetically as a human being is the opportunity to enjoy all these different eating experiences. It's so cool. What if all of that was taken away from you? That wouldn't be so cool, right? So what if we could give that to some of the kids we work with? That in itself, to me, would be a pretty cool outcome. Okay, so before you start this with your kid, you're going to think short-term goals, long-term goals. So goals or common areas to address feeding are things like the amount of food. Maybe your kid is underweight, and maybe they're not eating enough food. So that in itself right there is a clear, obvious goal. Maybe the more common one is variety, right? So again, the kid only eats 2, 3, 5, 10 different foods. We want to have a variety of intake across different food groups, right? So it's nutritionally appropriate. We want our kiddos eating starches, proteins, vegetables, and fruits. Yes, even if they're on the spectrum, they should be eating starches, proteins, vegetables, and fruits. And yes, you should too, by the way, eating your vegetables. Okay, a lot of kids have problems with texture, right? Some kids literally will not learn to chew textured foods if we don't get in there and teach them. So a lot of kids that I've worked with are still on baby food or pureed texture when they're 4, 6, 7 years old. So that might be a target. Self-feeding might be a target, right? So some kids on the spectrum remain dependent on others to shovel the food in their mouth. So that might be something to work on as well. So wherever your kid is at today, this is the basic idea in ABA, right? Wherever he's at today, be a little further along tomorrow, right? We can make progress. Every kid can learn. So first step is figure out where do we want to be 6 months, a year from now in terms of feeding. And it couldn't hurt, I'm not going to present it because I don't have time, but check out like mainstream nutrition resources. There's plenty of websites that tell you how many different foods your kids should be eating at different ages, what variety of vegetables and fruits and all that. So go check out those websites and aim high. There's no reason, just because a kid has an ASD diagnosis, there's no reason he should eat a smaller variety of vegetables or a smaller variety of fruits. That's not, there's no reason. The diagnosis does not cause that. It's not how it works. And the procedures that I'm going to talk about do cause variety to increase. They work. Okay, so of course, think about nutritional needs, all 4 food groups, variety is the main thing. A really cool thing that we see is when we do these procedures, and there's actually some research to show this, when we do these procedures, I think probably through exposure and through pairing with positive reinforcement, foods that used to be non-preferred become positive reinforcements later on. So kids do actually learn to appreciate a wider variety of foods. And probably, I don't know if there's data on this, but I'm pretty darn sure that you'll get a generalized effect in terms of flexibility. That as you positively reinforce trying enough new foods, eventually trying new foods in itself becomes a learned behavior. That the kid can now just be more willing to try new foods. Okay, so set a goal, make a list of fruits, vegetables, starches, proteins that you want to do. Whatever's reasonable for your house. Here's sort of a good, I don't know if it's a litmus test or a good sort of thought experiment for you is, what if your kid wasn't a picky eater at all? What would dinner look like? And for a lot of parents that I've worked with, they can't even imagine it. It's been so long and there's been so much frustration that they forgot what it would be like to just be able to cook whatever they want for dinner. Okay? Maybe that's the goal. Cook whatever you want for dinner. Like, forget that your kid has an ASD diagnosis. Forget that he was ever a picky eater. Go to the grocery store, pick what you want, cook it for dinner. That's what's for dinner. Maybe that's your goal. It's an ambitious goal, right? But it's an ambitious goal for a lot of typically developing kids. By the way, all typically developing kids can meet that outcome as well if you do these same basic procedures. Okay, so you got your goals. Think about some practical things like seating arrangements. Generally speaking, some problem behavior is going to happen when you're doing some of the stuff I'm talking about. So the environment needs to be safe. There should be nothing sharp or breakable. The kids shouldn't be able to fall off a chair, things like that. It's a lot easier to do this stuff early on when your kid's still in a high chair. If you still have high chair age kids, they're picky eaters, do this now. Do it this year before they grow out of the high chair. Because a high chair is a socially appropriate way to not allow the kid to escape. Right? Sorry, kid, you're in the high chair. And it's just safer. And it's a convenient place to put the food. It's just easier. If they're not in the high chair anymore, they're too big, okay. Doesn't mean you can't do it. It just means you got to be smart. Be thoughtful about the chairs. Make sure things are stable, maybe padded. Make sure they're not next to a window or objects that are going to break. Make a safe, predictable, clean environment. For materials, just do stuff that's safe and inexpensive, plastic, baby food spoons, things like that. Might as well make it fun. If your kid loves some particular character, Star Wars or something, get them a Star Wars spoon, right? Or get a Mickey Mouse cup or whatever. Definitely make it fun if you can. Same thing, you can get a placemat, with his favorite character on it, whatever. Okay. Why do you suppose picky eating occurred? And if someone's going to say because they have ASD, I already busted you. That's not the reason. So why does picky eating occur?
Because we're reinforcing inappropriate mealtime behavior.
Because we're reinforcing inappropriate mealtime behavior. Okay, you're either a behavior analyst or you've been trained by one. Okay, yeah. So let's take one step back even a little bit further. Like, why would they even be engaging in inappropriate mealtime behavior?
Well, because you have religion, a sensory version.
Yeah. Sure. So yeah, it's definitely a documented fact that a lot of folks on the spectrum have a real tough time with particular types of sensory input. We don't know why. Again, the diagnosis doesn't cause that, but it's a fact. A lot of folks on the spectrum have a real tough time with those particular types of sensory modalities. Okay, yeah, absolutely. So if like a particular texture or a particular color or a particular flavor is especially scary, frustrating, anxiety-producing, or whatever, then what you're likely to do is engage in some kind of behavior that people do when they feel scared, frustrated, overwhelmed, etc. Maybe crying, maybe pushing it away, maybe spitting, maybe screaming, maybe hitting, maybe biting, maybe banging your head on the high chair. And then as soon as you do that, or as soon as the child does that, and I'm a parent, I have 3 kids, I know the deal. As soon as your child does that, what do you want to do?
Take it away.
Right? Like maybe your kid feeling sorrow, maybe that's the worst feeling you can have. Right? Like wouldn't you rather get punched in the face than see your kid genuinely sad? Yes. Okay? So of course you stop making the kid eat that food. Of course you take the food away. Of course you give him a hug. Of course you reinforce the inappropriate mealtime problem behavior. We've all done it, even BCBAs like me, okay? It's the natural thing to do. It's the same reason why tantrums that have nothing to do with meals get reinforced. Of course you give the kid what he wants when he cries. You can't stand seeing him cry. And I'm not saying all of you do this, but I am saying a lot of people do. It's normal to do that. Okay, so maybe that's why. And as it turns out, there's a decent amount of research that has shown that in almost all cases, the reason why problematic mealtime behavior occurs is because the kid doesn't want to eat the food that you're presenting. And that engaging in that behavior, the problematic behavior, helps the kid get the food that he or she does want, or at least helps escape eating the food that they don't want. It's pretty basic stuff. Do the bad behavior, get out of the thing that you don't want. And again, no blame here. It makes sense, right? Everybody's behavior makes sense. The kid's inappropriate behavior makes sense, obviously. The parents' inappropriate behavior of reinforcing the kids' inappropriate behavior makes sense, obviously. We all do it. Okay. So now that we know that, I'll bet you guys probably already know how to fix it, don't you? Let's see. First, let's start nice. Let's start with the easiest, simplest, nicest, fluffiest, feel-good procedure you can possibly do. Just give the kid a bunch of stuff he wants. He or she wants. Just give them what they want for free before the bad behavior happens, okay? So you're still presenting the non-preferred foods, whether you're presenting bites like this or on a plate or whatever. So you set the expectation to eat the non-preferred food, but at the same time, you're presenting a bunch of other positive reinforcers for free. So you put on the kid's favorite music, you wear his favorite Star Wars costume, you wear a Chewbacca mask, I don't know, whatever. Do whatever it takes to make the environment fun and awesome and present the food, okay? It's called non-contingent reinforcement or environmental enrichment. The ABA idea behind that is it reduces the aversiveness of the eating environment, so the kid's more likely to try it by.
Does this also cover picky eating due to like oral motor control?
So that's a really good question. Am I going to talk about picky eating due to poor oral motor control? So I would say I'm not enough of an expert on oral motor development to know the fine points of that. Definitely not an OT. I will say that I've worked with a lot of kids who are really not good at oral motor skills, and part of it is probably because they never breastfed and they never chewed, right? They never developed those, so that's probably part of where those skills come from, right? So to me, it's kind of a chicken or egg thing. Like what would you do to help those kids develop that control? Practice, right?
Well, yeah.
Yeah.
Specific types of textures and foods.
Yeah. So basically, like gradually increasing those things is. I'll talk about texture at the end if we have time.
Okay.
Yeah. But see, that's a perfect opportunity for an OT and a BCBA to collaborate, because you probably have great ideas of like what particular textures to work on, or how to increase them gradually, or which ones might be easier before other ones, or what part of the mouth to put it on, right? What part of the tongue, so on and so forth. Okay, so first, NCR, really simple, just make the environment fun. Whoa, whoops. Present the food, okay? And by the way, for all of these procedures, you identify a meal to start with, like whatever size meal you want, start small, maybe 10 bites, okay? And a representative mix of all the different food groups. So a few bites of vegetables, a few bites of protein, a few bites of starch, a few bites of fruit. You present a bite. Now, if you're just doing non-contingent reinforcement and that's all you're doing, and the kid doesn't take the bite, they don't have to take the bite. So this procedure usually doesn't work, not on its own. It's not a real fix, but does it make the whole thing more fun for you and your child? Yeah. And is it worth doing? Absolutely. Why not make the environment more fun, right? Usually, if the child's still allowed to escape eating the non-preferred food, though, while you're doing non-contingent reinforcement, they'll usually still escape eating the non-preferred food. Okay, here's a variation on non-contingent reinforcement. You can give all that highly preferred stuff that the kid likes, whatever it is, watching a video, listening to music, playing on the iPad, whatever. Present a bite. If they take the bite, they keep all of that awesome stuff. If they refuse the bite, you take it away. So real simple rule, black and white. As long as you eat, you get to keep all your awesome stuff. The minute you stop trying, we take it away. And the only way you can get it back is by trying to take another bite. And if you're working on something really tough, like chewing a texture, maybe it's just an attempt even at putting it in your mouth and try to chew once. Great, keep your stuff. If you spit, cry, throw the stuff, whatever, or throw the food, we take your fun stuff away. The only way you can get it back is by at least making an attempt at meeting the expectation that you as a parent set. No arguing, no negotiating, no cajoling, no, I told you, no, you gotta eat your food, take the bite. You're not gonna get it back, you don't take the bite. We don't need to do any of that. It can be really simple. And do tell the rules though. At the beginning of the meal, say, look, you get to watch Barney or whatever, it's awesome, it's gonna be so much fun. But if you don't eat, then maybe you're not paying enough attention, we're gonna have to turn it off, okay? As long as you eat, we're gonna keep it on. And then you do it, you start. Be warned, the first time you take the stuff away, the kid's not gonna like it, right? You probably have a tantrum.
Are you going to start with the food that they're comfortable with, or are you going to start with the food that is something you're working up to?
Yeah, great question. So do you start with non-preferred food that's going to be a challenge right away, or do you start with something easier? Everything in ABA is always baby steps, start with something easy. So definitely like whatever the least non-preferred food is, start with that, sure, why not? So like let's say there's, broccoli, where he won't eat broccoli anymore, but he used to eat it sometimes, or he'll eat it every now and then now. That'd be a great first thing to start with, because you want the kid to be successful. This is not about punishing the kid messing up, you want the kid to be successful. Okay, here's some data from a study we published a while ago, I think 2001 or so. where I first tried this procedure. This was a 6-year-old kid in an inpatient hospital who was admitted for severe problem behavior and food refusal. And this kid was a severe feeding kid. He was 100% G-tube dependent, meaning no calories went through his mouth, no water or liquid of any kind went through his mouth. And we came up with this procedure, and we just did exactly what I just told you. We just gave him, his big reinforcer was listening to books on tape. So he'd look through a book and listen, there's a Walkman, a Discman back then. But he'd listen to the song or whatever on tape, and as long as and we would present bites of baby food on a spoon. As long as he'd take the bite, he keeps the stuff. As soon as he refused the bite, take the stuff away, okay? And then as soon as he takes the bite, put it right back. We've got 2 data paths here. One is spitting the food out, that's the triangles. The other one is eating the food, that's the squares. In baseline, there's no spitting because he wasn't eating anything, right? 0 consumption. During the treatment phase, consumption went up. No, sorry, that's spitting, right? So consumption went up immediately, and he's eating a lot of his food, but he's also spitting out some of it. But still, a huge change from baseline, right? Then we went back to baseline, consumption went back down. Then we went back to treatment, now he's eating a lot, and spitting went down. And then we increased the meal. We started with 20 bite meals, we increased to 40 bite meals, then we increased to 60 bite meals. Then we had mom start to implement it. He had one tough session, then did great. Then we had grandma start to implement it, or Gram as he called her. And she did great, and the procedure worked great. A couple years later, no more G-tube, done. Okay. This is just the first step, but it worked really well. And this is just baby food, still on baby food, but eating baby food and having enough nutrition from baby food is a lot better than eating only Ensure or Pediasure through the G-tube. Like, a lot better. It's real food, right? Okay. And later on, we worked on texture and chewing and other stuff as well. Okay, let's move on to good old-fashioned positive reinforcement. In the ABA literature, they call this DRA for some reason, differential reinforcement of alternative behavior, but it's really just positive reinforcement of eating the non-preferred food. It's the simplest thing in the world. It's the foundation of everything we do in ABA. If you want a kid to do something, or if you want anyone to do something, kid or adult, use a big reinforcer. It works. A lot of research, actually, in ABA has shown that this procedure doesn't work, and it's worked every time that I've tried it, pretty much. And most of the published research doesn't manipulate the size of the reinforcer enough, doesn't try big enough reinforcers, and doesn't manipulate the size of the bites, doesn't reduce it down to small enough bites, but I'll talk more about that in a second. Okay, so how do you do this? You pick at least one food that the kid absolutely loves, okay? And then you pick one food that is non-preferred, and you work on that first. And you present a bite of the non-preferred food. If he eats it, then he gets a bite of the preferred food. That's a real simple way, 1 for 1. You can also do a sort of all or nothing approach, where if the kid finishes the whole meal, then they get access to some preferred food, like a dessert, right? That's sort of the grandma treatment, like finish your veggies and then you get dessert, right? 2 different ways of doing it. The way that I do this most effectively is with a gradual fading procedure. So I will actually start with 1/8 of 1 bite of non-preferred food. So take a child-sized bite, like an appropriate size bite for that child, cut it in half, okay? Cut that half in half, and then cut that half in half. And then you have 1/8 of a bite. That make sense? Okay, present just that teeny little speck on a spoon or a plate, whatever modality you're using. And say like, all right, here you go, take a bite. If you eat your bite, you get a huge amount of preferred foods. So we might do like a plate of just any preferred foods the kid wants, even cookies, I don't care what it is. And they just get that plate for a while, maybe 30 seconds. You get the goodie plate for 30 seconds, and then you're done. Now you gotta eat another 1/8 of a bite. Then you get the goodie plate for 30 seconds, then you're done. Now another 1/8 of a bite, okay? The goal is gradually increase the requirement of non-preferred food in order to get the preferred food, right? And so the end result is eat your whole meal and you get a reasonably portioned dessert. Your whole, like, nutritionally appropriate meal, and you get a reasonably portioned dessert. And there's good research by Adele Nadowski and others showing this procedure works. And literally every time I've tried it, it works. And it's just a matter of being really slow and gradual. And you might think like, well, 1/8 of a bite, that's nothing, right? Well, yeah, 1/8 of a bite is nothing today, and a plate full of cookies is totally unreasonable nutritionally, right? Okay? But tomorrow, it's a 1/4 of a bite, and the next day, it's a 1/2 of a bite. You see where we're going, right? And by the end of a week or 2, now the kid's eating a whole bite, right? And then instead of getting a plate full of cookies, maybe getting a 1/4 of the cookie, right? And you gradually increase. And you might say, well, that's going to take forever. Yes, true, it takes a while. It might take a few months for you to get to your goal, right? But how long has your child gone with their picky eating so far? Probably more than a couple months, right? How long are they going to continue if you continue with business as usual? A long time, maybe forever. I mean, I've worked with adults with autism who only eat 2 or 3 foods. So if we don't fix it now, it's going to be harder to fix later. There's a Chinese proverb that goes, the best time to plant a tree was 10 years ago. Right? Okay, but don't beat yourself up, because the second part of the proverb is, the second best time to plant a tree is right now. You guys get that? So yeah, you should have fixed this before, but you didn't, and it's not your fault, it's okay. But you can fix it now. And waiting a month, waiting 2 months, waiting 6 months is only going to make it harder. You had a question back.
Just a question as far as implementation. Are you going to, in this scenario with the broccoli and cookies, for example, are you going to reintroduce the broccoli every day at dinner time?
Yeah.
Just continue to do that?
Yeah, great question. So yeah, when do you do the broccoli or whatever? What I usually do is start with a variety of foods. I wouldn't start with just broccoli. I'd pick maybe 4 different non-preferred foods that are goal foods and just kind of randomly alternate between them. If the kid's going to have a real tough time with that, and you want to make it as easy as possible, it might be better to just stick with broccoli until broccoli becomes easy, then carrots. Until that's easy, then lettuce, whatever, right? One at a time. But you do want to start integrating as much variety as possible as early as possible, because you don't want that to become like a rigid routine, like, oh sure, I'll eat my vegetables, but only broccoli, and only when you do it exactly like this, right? In the front, yeah.
So what do you do when you have a very stubborn child who absolutely refuses to do that and won't eat anything? So now you have a child who doesn't eat at all.
Yeah, yeah. So I'm going to show you some data in a second where, yeah, the kid waited his mom out. Wouldn't eat dinner. Wasn't willing to do it. He only had to eat, I think it was a quarter of a bite at that point. Wouldn't do it. He waited her out till dinner. So she said, okay, well guess what's for breakfast? Okay? And then that's what was served for breakfast.
Mommy dearest.
And she just waited. And it wasn't punishment. She's not being mean. It's just like, look, here's the expectation. I'm the parent. You're the child. It's reasonable. It's not going to kill you. It's not torture. It's an eighth of a bite of broccoli. You can do it, kid. I believe in you. I love you. You know what I mean? And now is when you're going to learn to be a big boy. But don't have a huge long conversation. That's much of attention for refusal, right? But you can have that conversation beforehand. If you know it's going to be tough, sit your child down and say, look, I'm so proud of you. You're such a big boy. You're such a big girl. You're going to learn how to eat your foods, and it's going to be awesome. Maybe, I'm sure you can find a book about picky eating that would probably be helpful to read that first. Or make up a story about a dragon that only liked to eat certain types of food or something, and then he learned it, you know what I mean? Make it fun. Make it as fluffy and supportive and wonderful and loving as you can, and then back it up with follow-through. And you don't have to be a robot. You don't have to be mean. You can be totally nice and smiling when you're doing the follow-through. You just have to follow through. Yes?
So does putting it in your mouth and spitting it out count as you getting a cookie, or you actually have to swallow?
Great question. I love that, because there's a treatment procedure for picky eating that has no research support whatsoever, and that's one of the first steps. And so a lot of ABA folks say, oh, we can't do that. We're not going to let the kid get away with that. Then we're reinforcing the wrong behavior, obviously, right? But I have, there are ABA folks that I know that I've worked with that they've done it, and that's fine. That's the first step. Or the first step could even be look at it, okay, without crying, and then you get the cookies. Then smell it without crying, and you get the cookies. Then touch it to your tongue, and then you get the cookies. Now put it in your mouth and spit it out, get the cookies. But you're still going to have to get to that step of, you got to swallow it. Okay? Yes?
I have a student, he's 17.
Okay?
He started feeding therapy in the summer. And his eating habits were he ate a box of wheat thins, a glass of water, a couple Starbursts for lunch every day.
Yep.
And as his mom has worked through this process of feeding therapy with him, we made pancakes yesterday. He took the tiniest bite of a little bit, but he took the bite.
Perfect.
He helped make the pancakes. He helped do it. And it's just been interesting. He would only eat McDonald's French fries. We went to Burger King. He ate the French fries at Burger King.
Great. So
And
that's like you're on the way.
the process takes time, and he's not by any means that far along.
Yeah.
But starting even at 17, it's
That's never too late.
it's working.
It's just easier to start early, but yeah.
Yeah.
And here's another thing too that I've noticed is a lot of people get the idea of trying to just make some little progress, right, and reinforce it. A lot of people do that, but what's missing with a lot of folks, if they haven't had training in this, is the follow through. So like, okay, he ate one speck of pancake today, tomorrow he's gonna need to eat another, right? Or he's not getting what he wants, right? That's the part that will really push the progress forward. Because a lot of picky eaters will try something randomly here and there every now and then, but if you wait on that, it can take years, you know? But it is awesome. Capitalize on that. Reinforce the heck out of it.
What about a student that gags and vomits?
Yeah, great question.
But they're cleared by a doctor.
Yeah.
But then they gag and vomit.
Yeah, so we've actually dealt with this successfully. No research yet, but we've done it clinically. And you can start with the smallest approximation of the behavior and reinforce the heck out of that and go from there. So you can start with the word for the food, like broccoli. If the kid doesn't gag, reinforce. Okay? And then I'm going to show you broccoli. As long as you don't gag, you get a cookie. Cookie, right? Now you're going to see it for a while. Now you're going to sniff it. Now you're going to touch it, you know. And it's just exposure is all it is. And if there's no medical reason for the gagging, then the gagging will decrease through repeated exposure to the stimulus. And if the gagging decreases, then the vomiting is going to go away. And we have done that successfully.
So I have another question. So I understand giving like a small portion of the broccoli in ratio to whatever their preferred food is. So we do this and we practice this feeding therapy session with our child. Are we still, like in my mind, I would see it going like we do this little feeding session between he and I, and then afterwards he could have his meal that he would normally
sure.
like to eat.
Yeah, that's fine.
Would that be appropriate?
Yeah, especially if it's successful in the feeding session, then absolutely. You know what I mean? That's
Because I
part
can't
of the
imagine
reward.
trying to do like that whole plate with him and that would be what he would eat and that he would take it all in at one setting.
So I'm going to tell you, it's up to you. You actually can do it that way. We've done
Really?
it that way too. Yeah. But if you want to make it easier on yourself, start small. Start with a one-bite meal. Kid, when you're done with this one bite, you get whatever you want for dinner. Okay? If you don't eat this one bite, you're not getting dinner. We're not going to let the kid starve.
Could we do like a combination of things on the plate, like, you know,
Of
the
course.
broccoli and
Absolutely.
carrots, and then
Absolutely.
on the plate there's like a divider of other things that he likes, and he can't
Absolutely.
get to those things until he's tried the broccoli so many times?
Absolutely. You can do anything you want. The only thing that really matters is the follow-through.
Okay.
Is just make some discernible effort towards eating the non-preferred foods, and then you get something that you want. And you can only get the thing that you want if you make that one little bit of progress. As long as you have that basic contingency or rule built in, you can do anything else you want. You know, and I'm probably overstating the case a little bit there, but pretty much. Because honestly, like any variation that I've tried of this same basic idea basically works, more or less. You just have to go slowly and be consistent. Okay, let's keep going. You don't have to use preferred foods as the, oh, and let me say one more thing though about not having dinner and about a kid not eating. I'm not in the business of starving people, right? Like obviously, I'm not gonna let a kid lose weight, no way, okay? Especially if they're already underweight. So if you're concerned about that at all, weigh your kid daily before you start this and get like a baseline of how much they weigh. Get one of those charts off the internet that's free and plot your kid's weight on the growth chart so you see like what percentile they are. Is he underweight? Is he overweight for his age compared to the average population? Because you don't want a kid dropping way down in percentiles. No way. So weigh the kid. And I'm here to tell you, like, it's an extremely rare circumstance that the kid will starve themselves to death. I've actually never heard of that happening once. I mean, I'm sure there is one kid out there that will do it, but I've never heard of that. Even that kid that waited out all night and waited, I think, 2 or 3 hours the next morning, still ate the bite eventually. And now he's eating tons.
I had a kid that waited 72 hours for a meal.
Wow.
Mom did give in at that point.
Yeah, so 72 hours is a really long time, and that's where you would want to know like the weight, you know, the kid's weight. And yeah, you're not going to starve the kid. That's not acceptable. You can't let the kid lose weight. So maybe you do have to give in, but then maybe you just have to make the intervention more effective by front loading it with bigger reinforcers. You know what I mean?
And
Maybe the reward has to be bigger.
And the reinforcer was also waiting us out. That kid would wait out for 2 hours until he would get access to that food. And I guess maybe
Yeah.
trying alternative preference assessments, maybe satiation of his preferred food, so I can
Yeah.
use that as a reinforcer,
Yeah.
trying different things. But
And the point is, get unreasonable. Make the reinforcer so big that it's like a no-brainer, you know? Like one kid that I worked with, when we very first started, it was his first vegetable, looking at any vegetable, an eighth of a bite of spinach to get a bowl full of ice cream. Okay? Totally unreasonable, right? But it worked. We gradually got there. Now he has totally appropriate, age-appropriate nutrition, no problem whatsoever. I mean, he's still kind of annoying sometimes about eating, but like, all kids are, that's probably, yeah.
Well, then I'd be asking the neutral food that's filled with plenty of
Yeah.
ice.
Yeah.
When it gets to that point, we get
Yeah.
heated.
Yeah, great suggestion. So if the kid really is waiting you out and trying to starve themselves, you can't let them lose weight, you can't let them starve. So give him some kind of neutral food that you know that he'll eat, but isn't like a big reward, you know? So he's not gonna get his favorite dinner if he waits you out forever, but maybe he can get bread and water, you know what I mean? Like something that's good enough. Okay, let's keep moving. You don't have to use preferred foods as the positive reinforcer. You can use anything you want. It just has to be a powerful reinforcer. So if you're starting with your kid who literally eats zero healthy foods, maybe start with an iPad or video or anything else as a reinforcer. And you do it the same way. Teeny little eighth of a bite, and then you get the iPad for a long time, and then you gradually work up to eat your meal, and you get the iPad or TV for a reasonable amount of time. Yes?
Can you say something about deprivation, like depriving the child of the reinforcer in order for
Yeah.
it to be effective?
Yeah, really good point, is deprivation. This issue of if you want a reinforcer to be powerful, then the kid has to have not too much contact with that reinforcer in the recent past. So parents, I'll tell you one thing, I don't know if your ABA folks have already told you, but I can tell you, and I'll tell you right now, they're thinking it if they haven't told it, man, don't give your kid that much of that stuff that we're trying to use as a reward, really. You know, if you want it to work, if you want us to be able to do our job, don't give your kid very much of that thing we're trying to use as a reward. And I'll tell you as parents, if you want your parenting behavior to be effective, don't give your kid too much of that thing that you want to use as a reward, okay? So if you're going to use cookies as the reward for eating the non-preferred foods, that should be the only time your kid can have access to cookies, okay? Is during those meals, those teaching meals. If you're going to use the kid's favorite video game on the iPad, that should be the only time that your kid can have access to his favorite game on the iPad is by earning it through eating healthy foods. Okay? And that doesn't mean you have to restrict it. You can get lots of access still. It just has to be earned for eating healthy foods. Okay. Start small, gradually increase. Here's data from... Yes, this is actually a Skype-based treatment evaluation project. So we thought, you know what? Most areas, even if they have behavior analysts, don't have behavior analysts who are trained in treating feeding disorders. You guys are lucky here to have Emily Mariner. She's highly trained in this and has experience right here in Phoenix. Most areas don't actually even have one BCBA who's highly trained in treating feeding disorders. So we thought, you know what if we could train parents from a distance? Let's just try using like Skype or FaceTime or something. Give it a shot. Like we know that training parents in person works. Maybe we could do it via telemedicine approach. So this is one kiddo that we're running so far, and he had already worked on picky eating he actually did have ABA therapists, but his team wasn't, no, that's not right. So he did have ABA therapists, and he actually had made a lot of progress with his therapist, but then as soon as he was done with therapy, as soon as the therapist left, he wouldn't eat the non-preferred foods. Went right back to the picky eating with mom and dad. And it's not like mom hadn't tried. She tried hard, lots, right? But honestly, she was making the same mistakes that we all make as parents, giving in eventually, or making it too difficult, starting with too much, or doing too much other stuff like getting upset, arguing, negotiating, etc. Not just keeping it simple. So for this is just a follow-up. So he had already made this progress with the ABA team, but not with mom or dad at all. These data are all collected by mom. This is the percentage of bites that her child ate of non-preferred food. Baseline is before we trained mom. This is just a meal with mom. Didn't eat one bite of non-preferred food, not one. These triangles are when our BCBA, Tara Lanigan, is on FaceTime. So she's looking through the MacBook on FaceTime, watching the mom feeding. No problem, right? Did great. And I think the mom just told the kid, like, look, I'm going to do the same thing as your teachers do. Like, just take a bite, okay? And the kid saw the ABA person, although not one that he had ever worked with, right? This BCBA, Tara, had never even met the kid, but saw the ABA therapist on the other side of FaceTime on the laptop and did great. Now, as we built up a history of eating with mom, with the therapist looking through FaceTime, the therapist said, okay, mom, you ready? You want to try it? Mom said, heck yeah, I'm ready. I'm going to give it a shot. You know, it might not work, might not be easy, but I'm going to do it. I got this. And it was easy, no problem. Ate all the bites. And this is with no therapist here at all, no iPad, no nothing, right? Kid doing great. And I'm forgetting exactly what these other changes and symbols are. I think this might be additional other foods or different meal length, whatever. So we're getting some variability, but still eating great with no ABA people present. Just the mom doing everything on her own. No one was ever there physically to help her. I mean, the kid did have some history with the ABA therapist, and for sure that helped, right? Obviously. But if you want to talk about follow-through and generalization to parents, all it took was one BCBA. And I don't know how much time is represented by this, but it's probably only a few hours of talking over FaceTime, spread out over a few weeks. And this is just positive reinforcement. If the kid refused the food here, he actually didn't have to eat it. He could actually get away with it. So this is just positive reinforcement for eating the non-preferred foods. You can try that first, it usually doesn't work. You usually have to just not let the kid escape from eating the non-preferred foods. But in this case, it worked. Okay, so escape extinction. I've been talking about how you gotta eat the non-preferred in order to get the reward, right? Well, the other piece of that is whatever bad behaviors you do cannot result in escaping eating the non-preferred food. Because if they do, right, the kid's gonna learn or remember, because he already learned, that those bad behaviors work and he doesn't have to eat the non-preferred food. So escape extinction is any procedure. It's just a jargony way of saying don't let the kid escape the expectation to eat the non-preferred food. So you set the expectation the same as you would, how I've been saying before, you present a bite, and the child cannot escape that expectation no matter what he or she does. That's it. It's that simple. There's a lot of procedural variations. One of the more like intrusive ones is you hold the bite right next, like let's say this is the kid's face, you hold it next to the mouth and you don't move the spoon until the kid takes the bite. It's called non-removal of the spoon. It's pretty intrusive. Kids hate it, parents hate it, but it works really well. I actually don't recommend you do that, parents. I don't think you need to do that. I've actually never done it once in my career. I've never needed to use it, but it does work really well. So if you have an ABA therapist trained to do it, maybe it's worth doing because it works super fast. Why? Because it's annoying to have a spoon right in your face, right? So other variations of that are, don't do this, you could hold it over here, right? Or you could just say, you're not getting out of the high chair until you take the 8th bite. Sorry, bud. That's it. As soon as you take the bite, you're out of the high chair. Okay. Question?
So I want to clarify, you mean literally that they cannot move from their chair?
It depends on your setup, right? Like, let's say you're not using a high chair. Let's say it's just sitting on a chair at a table. You're not physically going to restrain the kid. You're not going to like pin him down to the chair.
That's what I was wondering. I'm like, is that what he means?
No. I'm not talking about anything intrusive here at all. No, but you could just set the expectation. I'm sorry, bud. I'm not going to let you get up from the chair until you take a bite. So if he tries to get up, you just neutrally redirect the kid back to the chair. Or just put your body in the way so they can't escape. Maybe they can stand up, but they can't run away. They can't go do anything else. And if you're not able to physically block them, because they're too big or they're too fast or too smart or whatever it is, then okay, just make sure they can't have access to any other activity. Nothing else. Like they can lay on the living room floor like this if they want and not eat. Okay. But you're not getting anything else until you take that 1/8 of the bite.
Thank you.
Always start small. Always use lots of positive reinforcement. That's the important part. But preventing escape works. What's this? Okay, this was parent-trained treatment for picky eating, or parent-implemented, sorry. All these data, all these sessions were done by mom. No professionals doing any of the work. I was the consultant. What did I do? So I went and I talked with mom, and I made the plan with her, and I went and hung out in the kitchen while she did it. But I never did any of the work with the kid. I was basically just there at that point for emotional support for the mom, because I knew it was going to be really hard for her. And if she had asked a question, I would have given her an answer. Or if she did something really wrong, I might have prompted her. I might have said, oh, no, don't do that, But she did. She did fine, And I didn't want the kid seeing that I was the authority here with food, right? I wanted the kid seeing mom's the authority. I'm just there for support. So this is a kid who only ate, we published this in 2010, I forget exactly, but the kid ate maybe 10 or 12 foods in his repertoire. Before treatment, he was high functioning, I think about 6 or 8 years old. Sat in a regular chair, And in baseline, so here's the setup. I said, Mom, cook whatever you want for dinner. Because his whole life, she had cooked 2 dinners, right? One for the kid, one for the rest of the family, right? Kid ate first, you deal with that, then he can go have video or iPad or whatever, now the rest of the family eats, right? And I understand that, like, I totally get that, right? Like, one thing you need more than anything else is just peace in your home, right? Like, things just need to work, right? You need to feel okay. And so I get it. But also, what's the lost opportunity there for interaction with the family, right? Like, wouldn't it be awesome if you guys could all eat together, right? It's a nice time for family bonding, if you can make it happen. So that was the goal. We said, cook whatever you want for dinner, you're only cooking 1 dinner, period. I don't care what it is. Go to the store, buy anything you want, just cook it, okay? And then the intervention is, give it to them on a plate, like a reasonable amount. And I don't even think we did, we didn't even do the 1/8 of a bite thing. With this kid, we just went straight for the whole meal. I don't know why, but we did. For some reason, we had a hunch that it would work. So in baseline, he ate, and so whatever you normally cook for your kid, you probably would have some of the foods that the kid likes, right? You're not going to make him eat all non-preferred foods, right? So basically, this kid would only eat starches. So during baseline, he only ate the starches. So like if there was like rice and spinach and chicken on the plate, he ate the rice, but he didn't eat the spinach and the chicken. So he ate about 1/3 of the meal in baseline. Baseline was Mom not doing anything special, just saying, here's what's for dinner, I hope you eat it, you know. And he would eat about 1/3, and then he'd be done, and he'd go and do playtime. During intervention, it was exactly the intervention we already talked about, which is, sorry kid, you're not getting up from the chair, or not getting up from the table until you finish your meal. And then you can go play. And there's lots of fun stuff. There's playing with your brother, there's watching a video, there's all kinds of cool stuff that can happen after you're done with your meal, but you're not getting up. Obviously, if there's any kind of safety concerns, obviously you're going to let the kid get up, right? If they have to go to the bathroom, let them get up. You don't want them swimming themselves, obviously, right? But as soon as they're done with the bathroom, they wash their hands, right back to the table, okay? This kid did wait his mom out also, and this is not the same kid as the other one I was talking about, it's different. He waited mom out just once. On the first treatment, he didn't eat his dinner, he went to sleep with no dinner, and then that exact plate came out of the fridge, right on the table for breakfast. And he really didn't like having dinner for breakfast. That actually was a flexibility thing. It was perfectly healthy food, there's nothing wrong with it. There's nothing wrong with expecting the child to eat that food for breakfast. And he did, he ate it, and the rest of the time, totally fine. Ate whatever was for dinner. Mom did 100% of this. I was only there for moral, emotional support. We went back to baseline just to see if it was still necessary, and oh yeah, he figured it out. If I don't have to eat the vegetables and proteins, then I won't. So he stopped eating, went back to starches only. Then we went back to intervention, and again, worked great. He did one big test. And this is real common, even when a treatment works great, every now and then, the kid will just test, just to kind of be sure. You really still have what it takes, you know? And what do you got to do? Stick to your guns, right? No problem. And let me ask you this. How do you think the mom felt during this session? What's that? Failed, right? What are some of the things her mind was telling her? It stopped working. It doesn't actually work, right? It's not going to work. I'm a bad mother, right? For sure, she was thinking harsh stuff like that. Why would I do this to my kid? He's sad, he's upset, he can't handle this. He has a disability. What the hell am I doing? Making him wait and sit at a table for an hour, right? Of course she was thinking all these things to herself. It's normal to think all these things to yourself when you're putting your child through a challenging experience, right? But I'll submit to you that growing up is hard, whether you're on the spectrum or not. Growing up is hard, right? Becoming more responsible, more mature is hard. Most great things you've done in your life are hard. Being a parent is pretty hard, right? But it's not like unethical or mean that someone made you be a parent, right? You see what I'm saying? Like, it's okay for your kid to be challenged, really challenged, if it's for a good reason and it's going to produce a good outcome, and he's safe, right? And taken care of and loved. And there's 10 times more positive than anything challenging. Yes?
So did all those plot points where the intervention is, are those all with the mother feeding the son? Or
100%.
And so do they get to the point where they'll accept those foods and feed themselves?
Oh, no, I'm sorry, no. Mom was administering the meal, but this was all self-fed. He knew how to use the fork. So
Okay.
he was self-feeding.
So was she still like sitting with him, having him prompt him to take bites?
She was hanging around the kitchen. So, no problem. No way.
Okay.
He
No
knew.
reinforcing of the bites or anything, just had him sit at the table until he finished his
The
plate?
reinforcement is go play when you're done.
Okay.
You know what I mean? Which, when you think about it, that's the reinforcement that we all get, right? We got to do the job. And when we're done taking care of business, we get to go have fun, right? So if just a normal, totally natural consequence like that is gonna work, it's great. Like, why do some big contrived thing that's not like real life if you don't need to? Usually you do need to. This was kind of ambitious. I don't know what I was thinking, honestly, but it worked. She pulled it off, right? Mom did it.
How old did you say this child was?
Forget it. I have to look at the article. Probably about 6 or so.
6.
He was pretty high functioning.
And you said earlier that he ate like the starchy part, the rice.
Yeah.
Would she, I'm just trying to imagine my son doing this, was she like helping him to eat chicken and spinach, or was she just saying, nope, you have to eat that first before you get down?
No help at all. None.
Okay.
10 minutes. Okay, no help at all. Here's what's for dinner, kid.
Okay.
And have a good attitude about it. It's exciting, it's fun, it's awesome. We're gonna have a great dinner, right? But if you don't eat, you're not getting up.
And she went from rice to you're eating the whole thing. Okay.
Yeah. And it was tough. I mean, this session, this dinner was hard, real hard for Mom. But then look what happened, right? This dinner, hard. But then look what happened. Yes?
So it only took one meal for the child then to eat the whole meal without any prompts?
Yes.
Wow.
And did they have any conversation about it ahead of time? Like,
Sure,
we're going to have
absolutely.
dinner and this is your expectation?
Absolutely, yep.
Okay, so
And
if
the
you
kid
have a
was,
child that's not as high functioning verbally.
yeah.
That was my thing.
It'll take longer, yeah, sure. So anytime a child can understand verbal descriptions of rules, then their behavior is able to change faster. If they want to, though, right? Doesn't mean they'll do it. But if they can understand it, it's possible to get faster behavior change. We call it rule-learned behavior in ABA. But the same exact consequences work for kids who have no language whatsoever or no vocal speech whatsoever. Same stuff works. It might take a little longer. And I definitely would not start with, you have to get a whole plate before you get your reinforcer, right? No way. Start with an eighth of a bite. The kid sees the big reinforcer right there, looks down, there's a spoon with an eighth of a bite, it comes towards his mouth, and then you get your big reinforcement, right? Okay, got 10 minutes, got a few more things I want to talk about. Just more Skype-based intervention. This was same exact treatment. This was a kid in a high chair. He was younger, so he sat in a high chair. You're not getting out of your high chair until you're done. Same exact. But we did actually do some preferred food, as reinforcers as well. But all parents implemented all through Skype. The mom did great. Okay, Extinction Burst. Extinction Burst is the fancy ABA term for when a bad behavior doesn't work anymore, the kid will try harder. And it's ubiquitous. And it's just a fundamental principle of learning. That's how it works. And by the way, not just with kids, with adults too. Have you ever, I'm sure you've noticed some really inappropriate spousal behaviors in an argument when you say something and it doesn't work, right? You're not winning the argument, what do? You say something a little meaner, right? Well, it's the same exact idea, right? So maybe the kid says, no, I don't want to eat it. Sorry, kid, this is what's for dinner. No! Okay, then, right? And you will see an escalation in behaviors. But here's the cool part. By definition, extinction bursts are temporary. They go up and then a rapid decrease, by definition. If the behavior goes up, it gets worse, and stays worse, your treatment's not working. That's not, don't do that, right? But if the behavior gets worse at first, I hate to tell you, it's a sign it's working. It's actually a good sign. It doesn't feel good, it's not easy, but it's a good sign. Just stick to your guns, because I'll tell you what, if you're not going to stick to your guns, don't even start, okay? Because if you try this, the kid's behavior escalates, and then you can't take it, and then you give in, what did you just teach the kid? If a little bit of bad behavior doesn't work, try more, right? So you can actually make the kid's behavior a lot worse. You can as parents, I can as a parent, we all can as ABA and speech folks, right? If we don't follow through, we can teach the child to behave worse. We're running out of time. I want to get to the last bit. This is a picture of my baby eating her first pancake. Mickey Mouse pancake. Okay. Raise your hand if you're a parent with a child on the spectrum and this sounds easy. Okay. I have a kid who's a really picky eater. It was hard. Really hard. Really hard. And he's still not perfect, but his nutrition is great. He eats a healthy variety of foods. He's still a little bit of pain, kind of annoying about food, but it's not the end of the world. He eats a healthy variety of foods. So, what can we do? So everything we talked about so far is about changing your behavior, right? Like as parents, I've given you the tools. Raise your hand if this kind of makes sense, everything we talked about, these tools. Kind of common sense, right? Do we really need a whole science of this, right? It's kind of a science of common sense. Well, actually, maybe we do, because no one's using common sense, right? Maybe we do need science. I don't know. But we don't need a bunch of research and a bunch of science to understand it. It's kind of what we knew all along, right? Like when your kid is being a punk about not wanting to eat something healthy, got 5 minutes today. Don't you kind of think like, oh, it's frustrating, just eat it. It's so frustrating, you should eat this food, right? Like, we kind of know already. We should make them eat it, right? We kind of know. But just knowing it is not enough, right? Everyone knows they should eat a healthy variety of food, but we don't. We eat junk food. Everyone knows we should exercise on a regular basis. Most of us don't, right? Everyone knows they should quit smoking. Thankfully, most people do now. Still not everybody, but right. So knowing is not enough, because when you implement these things, or when you try any major behavior change, difficult things come up. And DJ Moran's talk this morning was all about this, right? It's not enough to just know it, because as you implement these things, difficult things come up, like difficult thoughts, like saying to yourself, I'm a bad parent, he can't take it, this is mean, this is torture. And by the way, your kid might tell you that. Are you trying to kill me? This is torture, right? Difficult emotions are definitely going to come up. We already talked about this, right? I'd rather take a punch to the face than see my kid cry, literally, right? Way rather, okay? So, of course, the natural response is to make the choice that will take away those bad feelings right now, in this moment. And you know how to do that. The way you take away your bad feelings in this moment is give your kid what he wants. Don't make him eat the vegetables. That's how you make yourself feel better right now, in this moment. Okay? And it'll make him feel better right now, in this moment. For sure, right? So, we know there's lots of choices that we need to make that don't feel good in this moment, right? Like, just being a parent. Being a parent, like, for me at least, it doesn't always feel good in the moment. It's really hard, right? But I value it probably more than anything else in my life, trying to be a good dad, And I'm not perfect. I make a lot of mistakes. All these mistakes I've been talking about, I've made them myself. Going to work, who here genuinely loves working all day, right? Very few people. I love my job. I have a cool job. Like right now I'm at work. Look at this. This is awesome, right? But still, like, is this what I'd rather be doing? Not really. I'd rather be with my family, I wouldn't really rather go to work all day. If I didn't have to support my family, I'd be with them, right? But I do it because I need to support my family, and I want to inspire my kids for them to see that they can do anything, right? And so I'm willing to do what's difficult. I'm willing to sit with something that I really don't want to do in this moment because of the delayed outcome that it'll produce, because of how much I value that outcome. So, don't you sometimes feel as a parent like you're just surviving, like just survival mode, just getting by? Of course, totally. And so, at any given moment, it doesn't necessarily feel like an emergency, right? Like, don't you sometimes feel like you're in sort of a slow motion emergency for years, like every day, right? So a lot of times, like in this moment, you say like, oh, God, I'll deal with this tomorrow. There's only so much I can take, right? But let me ask you this. What if you picked one goal, one outcome that mattered to you more than anything else? And what if you said to yourself, maybe I'm willing for this goal in this moment right now to be the fight of my life? Maybe I'm willing to make this the hardest thing I do in my life. I'm just saying it's a possibility that we can make that choice sometimes as parents. I'm not saying you have to. It's your kid, it's your choice, it's your world. But maybe it's worth it, right? You can always change your mind later. Just don't change your mind in the middle of the Extinction Burst. Okay, so DJ already talked a lot about this, but there's this big myth that if you have certain thoughts or certain feelings, then you have to engage in certain behaviors. If I feel like I'm going to die, I have to stop doing that, right? If I feel like I'm a bad parent, then I better do something different, right? Well, of course, make good decisions, like don't be a bad parent, obviously, don't actually hurt your kid, but the feeling that you're being a bad parent, or saying to yourself, I'm being a bad parent, is not the same thing as being a bad parent. Asking your kid to eat a reasonable amount of vegetables is not being a bad parent. Actually, we have another name for that. Great parent, strong parent, heroic parent, brave parent, dedicated parent. So, maybe it's worth it. Maybe it's possible that while you feel horrible, you can still put one foot in front of the other. While you feel like you're going to die, while your kid is tantruming, literally feel like you're going to die, like your heart's pounding. Maybe you're crying on the inside. Maybe you're crying on the outside. Maybe even then it's possible to not give in. Submit that to you as a possibility. So a lot of research that TJ talked about has shown this really conclusively. The harder you try not to feel, the more you're going to feel. The harder you try not to think bad thoughts, the more you're going to think bad thoughts. You can't get away from them. But you can walk towards your values. You can take steps in value directions. And there's specific behaviors you can do that help you contact those values. So like, what is feeding connected to? Feed, like today, eating a healthy dinner doesn't matter really, right? Not really. And that's why we get away with not making our kids do it today. Because it's not going to have a nutritional impact tomorrow, right? But long term, 0 minutes. Okay, no problem. On the last few sentences. But maybe there's long-term values. Maybe it's nutrition for my kid, being a healthy kid. Maybe it's gaining weight if your kid is underweight, right? Maybe it's becoming more flexible. Maybe it's all those social opportunities that we don't want our kid to miss out on. Maybe it's even teaching my kid that it's okay to really not want to do something, and it's worth it to do it anyways because a good outcome happens. Maybe your kid, while you're following through with your kid, maybe your kid is learning the same lesson you are, which is, this sucks right now, and I'm going to do it anyways. And it's going to make me stronger. Maybe your kid will learn to be a stronger, more persevering individual if he or she learns to eat a variety of foods. And learns from you through modeling that, man, some things are worth it. We're not going to back down. We're going to do it. So, you have the tools. This woman's one of my heroes. Zoe Kopowitz has done the New York Marathon 37 times or something. She has a record for the slowest pace. It takes her 30 hours or something like that. She has multiple sclerosis. She does it on crutches. She doesn't give up. And definitely not trying to guilt trip anybody here. But if she can do that, right? We can make our kids eat a bite of broccoli. So you got the tools now. So you're going to turn this into this. You're going to turn this into this. You're going to turn this into this. Keep it simple, start small, lots of positive reinforcement, be consistent. It's not supposed to be easy, it's supposed to be hard, but it gets easier. You're worth it, your child is worth it, their nutrition is worth it, their outcome is worth it, and you can do it. Thank you.